Welcome to the Public Health Millennial Career Stories Podcast, episode number 7.
We're a CEF accredited school, so anybody looking into public health programs, just make sure your program is CEF accredited. That's the accrediting body for public health. So everything you need to know, you're going to have in your curriculum, regardless of concentration. It's just a matter of what are you more interested in, and where do you want to go, after the MPH.
This is the Public Health Millennial Career Stories Podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Today we have a friend of mine. She was a former co-worker of mine at my internship at Florida Council as an HIV prevention planner. She's a double gator, getting her Bachelors of Health Sciences at the University of Florida, then going on to getting her Masters of Public Health in the concentration of Social and Behavioral Sciences. She currently works as a health science and public health program recruiter at the University of Florida. She is Katherine Pizarro, MPH, BHS. I am really happy to have Katherine on the show today. This episode is going to be a little bit different since we're going to be talking a little bit about UF's public health programs and then talk a little bit about Katherine's story. So how are you doing, Katherine?
Hi, I'm doing well. Everything's obviously a bit crazy for everyone, but I'm truly blessed. My husband and I still have our jobs. We're able to work from home. We're all healthy and safe. I think everyone's a bit disheartened about, the pandemic, and, racism has come to light like never before, or in my lifetime that I've seen. But I would say that it's an important time for public health. These two things, between the pandemic and what we see going on with racism, those are public health concerns and topics. For the pandemic, anything related to prevention and listening to those who have experience, and even racism, like access to healthcare, housing for minority populations, those are all public health concerns. So I think that if anybody wants to get involved with public health and is inspired by, movements we've seen, I think now's the perfect time.
Yeah, and I absolutely agree. COVID-19 has definitely shown a light on all the disparities within the Black community and other people of color communities. So thank you for sharing that. And public health is always a great idea. So definitely get involved.
Yeah.
So with that, I want to start off with talking about UF's Bachelors of Public Health program. So why should someone choose UF's Bachelors of Public Health program?
Yeah, so I mean, UF is ranked number 7 nationally. So between the network, the alumni that is going on at UF, the resources, I mean, it's unparalleled. The Bachelor of Public Health program specifically is a limited access program. So what that means is that you have to apply into the program unlike other majors. So what that does is that allows for the program to have a high quality of applicants. We can really make sure that the resources that we have are select for a number of individuals. So whether that's instructor to student ratios, access to your advisors, access to general resources, that's what I think sets us apart. We're also part of the Health Science Center. So the area in which you would be taking classes and individuals that you would be interacting with are not only public health, individuals, but, students that are in College of Nursing, College of Pharmacy, those who are looking to in the medical school, it's all very interdisciplinary. So I think that that's awesome.
Okay, great. And just so if no one knows, University of Florida is in Gainesville, Florida. So Central Florida, I would say.
Yeah.
North Central. I don't know if that's a thing.
Yes, yes, it's North
Yeah.
Central.
So, what are the prerequisites to get into the program?
They're very general prerequisites. Most of them are the general education requirements that we have here in Florida. But to specify general biology, stats, we ask for 6 credits of social and behavioral sciences courses. So those are the state core that I was speaking of, Comp 1 and 2. One course that is a little maybe not so common that we ask for is an advanced writing course. There's a lot of writing that goes on in our courses, so we want to make sure that that's something that you've had experience in. And then we just have a 3.0 GPA minimum, which is our basic requirement.
Okay. And yeah, I definitely think writing is important. I remember when I was interning at Well Florida, Lindsay, who was my boss at the time, definitely said that UF needs to do a little bit more to get people to write better because she was correcting a lot
Yeah,
of the things I was doing. So I definitely think I see value in that, and my writing has improved. So that is something to
for
take.
sure. That definitely comes with practice, and some comp classes, they don't. Some professors don't give feedback. So you do the assignment, you get a grade, but it's the feedback that really is going to help you become, a better writer. So yeah,
Yeah.
super important. Still trying to learn to this day, improving.
Yes, and I think it's just about those slow improvements.
Right.
Yeah. So can you describe the Bachelors of Public Health program structure a little bit?
Yeah, so as I mentioned before, it's a limited access program. So when you, for instance, apply to UF, you can track for the major, but that doesn't mean that you're officially in it. But your first and second year is typically just your general education requirements, any electives or classes that you want to take and explore. A lot of individuals that are interested in public health also have an interest in medicine, so either pre-med, pre-dentistry, pre-health professions. So a lot of those classes are going to be filled in with those, heavy science courses. Your sophomore year in the spring, February, early February is when the application is due for the Bachelors of Public Health program. So you apply and then you would start the program your junior year through your senior year. So you still have space in your curriculum to keep taking those prereqs that you need for other, professional schools. But in your curriculum, classes are made up of US healthcare systems, epidemiology, critical issues of public health. We also have, which is my favorite, the service learning practicum. So that's basically an opportunity for you. It's kind of a mini internship. So it's an opportunity for the student to work with the community agency and make some type of deliverable for them. So service them in any way that that specific agency needs. So that can be through writing, through setting up a needs assessment, through surveys, through things like that. So really applying those skills that they've learned in courses. And yeah, the courses that I mentioned are just a few, but a variety of things. For instance, US healthcare system, that is such a complicated, thing to navigate, that a lot of people who are interested in, dentistry or medicine, I think, if you don't understand how you're getting paid or how your customer is getting the funds to pay you, or, what that all looks like, that's just not something that they would teach, traditionally. So having that information, I think is amazing.
Yeah, and I agree. I was a pre-med biology major, and we never learned anything about the US healthcare system. We learned like our biology stuff, and I only learned about public health when I started my MPH, really. So I definitely think people in Bachelors of Public Health program definitely have a leg up. And even if you're not going into public health, there are a lot of classes that cross-sect a lot of different fields there. So,
Yeah, absolutely. One class that I took myself, but I TA'd for, that I know a lot of students took away from it was therapeutic communications. So it's basically kind of a role-playing course, well, one of the elements is role playing, where you have to communicate to your patient, um, I'm so sorry, we're going to have to amputate your leg. So how you build rapport, how you break the news to them, you know, just communicating those, that's not easy, information to give someone. So being able to do that properly and, sympathetically and, just it's just skills that I know that when I go to the doctor, sometimes they lack. So I just would want, whether you're a public health professional or going into medicine or nursing or anything like that, for you to have that in your back pocket for sure.
And yeah, and I think that's something that the healthcare system needs to improve on. A lot of the doctors are just, okay, they know their biology, they know medicine, they know pharmacology, but they don't know the interpersonal skills dealing with patients. And I think there's a huge
Right.
disconnect there. So
Yeah.
definitely, thanks for talking about that. So
Mhm.
what sorts of internships opportunities are available? And I know you spoke about a practicum a little bit earlier.
Right. So that we have a lot of community partners in UF. So anywhere from Health Street, Swanee River, AHAC, well, Florida Council, these are all nonprofit organizations that are in Gainesville, that do a variety of things. Um, we also have institutions within our university. So for instance, the Southeastern National Tuberculosis Center, that is a CDC funded program that does AIDS education, that does tuberculosis, and it deals with comorbidities like AIDS, things like that. Um, there's a lot of things that are established, but also kind of depending on what's going on in the college or in the university in general. Some researchers have projects that you can work on with them. So, I mean, the possibilities are really endless, and more, especially now, this past spring and currently summer, we've had to get creative with what types of internships or service learning um, projects we have or opportunities. Now we're doing a lot more virtual things that you can collaborate together. So maybe it's not something particularly in Gainesville or at UF, but if you found an opportunity outside of these parameters, kind of, for instance, a friend of mine was doing an internship at CNN in Atlanta, but was also doing a project for a healthcare blog. So that is, as it meets the criteria, the possibilities are endless.
Yeah, and I agree. And when I was and do my MPH, I know there were a couple of students that did internships in, I want to say, DC, and the staff were definitely very supportive. I want to say they're the ones that shared the experience and also like gave her a recommendation to be able to get into that position, which really helped her in her career. So switching gears a little bit, I know that UF has a dual program, bachelor's and MPH, and I thought that was really cool just because you're able to get your MPH and your bachelor's within 5 years instead of doing like 6 years. So do you want to just talk a little bit about that program?
When it comes to health professions, public health is not always at the forefront. So a lot of students come in wanting to be pre-med, pre-dentistry, pre-vet. And for one reason or another, either that doesn't work out or they truly find a passion in public health. So obviously we offer the Bachelor in Public Health program, but something else we offer is the combined bachelor's MPH program. So really, regardless of whatever bachelor's you have, what you can do is you would apply to the combined degree program summer of your junior year going into your senior year. What that means is that your senior year, you would be taking 5 of our MPH courses. So that gives you a 15 credit head start to the MPH program. Typically, you go straight into our MPH program. However, some individuals have been able to find different opportunities. So whether they go directly to a PhD program with those graduate credits, or they decide to go to a different school, you're taking graduate level courses as an undergrad. And again, that's 15 credits. So the benefit of that is obviously saving time and money. So you are charged a graduate rate, but typically with individuals, they are able to use their financial aid. In Florida, a lot of us have Bright Futures, so it covers a portion of that. And then at that time, you're not. I remember my senior year in college, there was just some classes that I was like, I mean, I like the course, but do I really have to take this? Like, I mean, I was just filling up my curriculum to a point. So that wasn't always like the best way to spend my money. So if you ever are having, questions about, maybe that class isn't for me, making sure that you use those classes wisely, and, taking graduate level courses is amazing. Very similar to what you would see, high school and dual enrollment. That's kind of what it looks like for us on the graduate level. But yeah, I mean, you as an undergrad are able to be in smaller classes because graduate level courses are, typically a lot smaller than undergraduate, which means you have better access to your teacher, your instructor, better access to your teaching assistant, and you're working in the same classroom with individuals that are older than you and, essentially in theory wiser than you. So you can develop those relationships and learn, both professionally and academically.
Okay. Yeah, and definitely seems like there's a lot of flexibility there. So when you're transitioning from your junior into your senior year, you have to choose the concentration that you're going to pursue in your MPH also?
So as soon as you apply to, whether you're a combined degree student or a traditional MPH student, you have to choose your concentration. The traditional MPH program is 48 credits, with the combined degree students having a 15 credit head start. So it moves pretty quick. A traditional student finishes the program within 5 semesters, with the fifth semester being the internship. So there's really no time for you to either switch a concentration or not start working on the concentration as soon as you start. Very rarely do we have individuals that want to switch, um, but you do, regardless of which concentration you choose, you do have those 5 core MPH courses. So that's going to be biostatistics, that's going to be U.S. healthcare system, a environmental health course, a social and behavioral sciences course, and I'm missing one more. Oh my God.
Epidemiology? Yeah.
Epidemiology. How could I forget that? What's going on with me? Um, so yeah, I mean, when you graduate with an MPH, your concentration isn't specified on your diploma or anything in particular. We're a CEF accredited school, so anybody looking into public health programs, just make sure your program is CEF accredited. That's the accrediting body for public health. So everything you need to know, you're going to have in your curriculum, regardless of concentration. It's just a matter of what are you more interested in and where do you want to go, after the MPH. But it really is also outside of your MPH curriculum. So what your internship experience was like, what volunteering did you do, what research did you do, did you take any additional, grant writing courses, or not courses per se, but opportunities or seminars, things like that. Those are the things that are really going to determine like what you're going to be more prepared for. If you ever have questions about concentrations, I can obviously help you with that, but just kind of start what is more interesting for you, and then there'll be a concentration based on that.
Okay, okay. And so talking about the Masters of Public Health program, what are the requirements to get in and what are the concentrations that we're talking about?
Yeah, so for the requirements, we require a bachelor's degree. It doesn't have to be from any specific major. We require 3.0 GPA minimum, and then we require competitive GRE scores. What we consider as competitive is anywhere in the 50th percentile and above. We do look at our applicants holistically. So what that means is that we take into consideration your GRE scores, your GPA, letters of recommendation that you submit, your personal statement, which is super important because we understand that, your GPA may be a little funky just because maybe you had a bad freshman year or you were going through something your senior year. Your GRE, not everybody is an amazing test taker, and we understand that the GRE isn't the most important factor in determining whether or not you're going to do well in graduate school. So we definitely look at all of that holistically. Your letters of recommendation, super important, just because we can see how you're doing academically through your GPA. But we want to know, what are you like in the classroom? Are you collaborative? Are you participating? What is that going to look like, once you are in the classroom here at UF? So all of those things are really important for us. We just want to see that you have a passion for public health. Maybe you don't really have experience in public health, but just kind of seeing that through your statement of purpose is very important. We just want to make sure that you're going to do well in our program and that you're going to benefit from our program. So once we have a good feel for that, is what going to determine whether or not you are a good fit, and vice versa. And then you said the concentration. So one of them is biostatistics, environmental health, epidemiology, social and behavioral sciences, population health management. And we also have a public health practice concentration, which that is typically for individuals that already have a graduate or terminal degree, or they've been working in public health already for a number of years. So that one's a little different. But yeah, all of them, are amazing and have those core courses. It's more so their concentration courses and electives that is going to make it a little different.
Okay. And I see that you all changed the health management and policy concentration to population health management, which I actually really like. I advocated for that when I was back in UF. So yeah, that's great to see. What is the structure of the program? I know there's an online version and there's an in-campus version. I know there's a accelerated MPH and then there's a regular MPH. Just talk a little bit about that.
Yeah, so we have both on campus and online. On campus, we offer those 6 concentrations that I mentioned previously. Online, we offer public health practice and social and behavioral sciences. So again, public health practice is more so for those individuals that already have a graduate or terminal degree. The difference between accelerated and traditional is that our accelerated applicants or students are going to be those that have a terminal degree. So it's going to be 42 credits rather than 48 credits. So it's just a shorter time frame. And then as far as our traditional on-campus program, that takes 5 semesters. We offer the program full-time and part-time. And then for online, as long as you finish the program within 7 years, you're good to go. Our online program started more so for individuals that are working, and we really try to work around that. And for that, our on-campus program, you do not have to come to campus for any reason. I'm sorry, our online program, you don't have to come to campus for any reason. So all the test taking is proctored through your webcam. The courses are asynchronous for the most part, meaning that, there's a recorded lecture or presentation, so you can access it at the time that, works best for you. Because some programs, you have to be logged on or online at a certain time, like a class time, which just isn't something that has worked for our students. We just want to provide as much flexibility as possible. And yeah, I think that's basically it for that question.
Yeah, I think that's everything you covered. Okay.
Perfect.
Yeah, thanks for covering those things. So I know when I was in my MPH, we did internships, and I think now it's switched over to practicums, and we were only allowed to do our internships at the end of the program, and I think that's also switched.
Basically what you remember as internship and seminar, so that's going to be applied practice experience and capstone. So whatever we went through in seminar, that's going to be more so capstone. And capstone is also where you develop or kind of discuss your deliverables. So what you present on Public Health Day which is basically a day where all of the MPH students that are graduating present the work that they've done, or a deliverable that they've done for the agency that they were interning or working with. So applied practice experience is basically that experience of you working and applying what it is that you've learned in courses at the agency. And then the capstone is um, everything else. So anything related to leadership in public health, anything related to how to expand your writing skills, how to find a job after your MPH, and kind of tweaking your deliverable, that's going to be in capstone, and that's going to be more in a group setting, whereas your applied practice experience is going to be your individual process with that agency.
Thanks for that clarification. So, to, I guess, end off everything with the Masters of Public Health program, what would you say are the benefits of choosing UF's MPH program?
Yeah, I mean, very similar to what I mentioned before with the bachelor's program. I mean, we are in an area in the university that is just flooded with, motivated individuals, whether they're students or instructors or researchers that are just have a passion for health in general. Um, Truthfully, our health science center generates a lot of money as far as like funding, grants, things of that nature, that I believe, if I'm not mistaken, is more than our football team and like football in general at UF, which is a huge thing. There's just so many different opportunities for you. Speaking of football, like, trauma and head injuries in football, that is something that our public health students and public health professionals in our college that are working on. So it's just very, forward thinking. I feel that our instructors, young and old, elderly, are always just looking at best at best ways to to address issues. So yeah, again, interdisciplinary, funding and resources, that is important. At the end of the day, you know specific to public health, depending on what the government feels should be the funding for public health at the time, it is a struggle. So being able to work with individuals that are creative in the ways that they're approaching situations with limited resources, like those are things that you're going to need if you want to be at the forefront in public health and be successful in public health. So those are all things I feel that we do very well.
Yeah, and I echo that definitely. There are a lot of opportunities in Gainesville, whether you want to work in like the healthcare side of public health, or if you want to work on the nonprofit side, if you want to work with research. There's so many professors doing different work, and if you really put yourself out there, they will definitely try to help you. Another thing I wanted to touch on was the interdisciplinary learning. There's what is the part of the MPH program that has to do with that? There's like a where we meet with the other health science, well, medical students, dental students, PT students, and all of those such.
Yeah, it's basically a 2-day experience that students have. I believe their spring semester of their first year. It's basically a time for everyone under the health science umbrella. So, veterinary students, dentistry students, pharmacy students, medical students, nursing students, and our public health students, for all of us to come together and work through different scenarios. So basically, it's one student from each of those professions come together and basically spend 2 days together, and complete different exercises. So the purpose of that is for you to really, for it to sink in to each student how important every single profession is to one another. Sometimes these professions are in silos when that isn't the case. Things are connected, and that's the reality. But when you're in the classroom, you're only really learning, for the most part, about, your lane, so to speak. So I think for public health students in particular, it's very exciting when, there's a scenario and, the public health student snaps back quick because it's just things that other people, wouldn't think about. And again, as I mentioned, public health isn't at the forefront of, health professions as, medical students are. So being in that environment and being able to really have the wisdom that public health students have is an awesome opportunity. So, I mean, basically, to just wrap up your question, it's just a time for everyone to learn from one another and understand how all of these issues are connected. And when you see somebody, your patient in your chair in your office, understanding the steps that it took for them to get there and looking beyond the signs and symptoms. So yeah.
Yeah, and I really enjoyed doing that 2-day thing with all the different health science students. And what was interesting to me was that most of the activities that we did, I was leading my team just because no one really knew what to do. I definitely had the knowledge and the skills to address the situations that were brought up better than any other of the schools. So I definitely think UF is doing great in that in regard. So I
Yeah,
really
I agree.
yeah. So switching gears completely now, we are going to talk a little bit about your public health story. So where does public health start for you?
Where does public health start for me? Um, I think so. As far as education or what inspired me to go into
Well,
public health,
let's see what inspired you.
Um, so I mean, I've always liked everything. I think that like amongst my sisters and like my family, I've always been like the more creative one. So throughout, my whole time in school, I I liked art. I liked business administration. I liked, international affairs. I liked medicine. I liked a whole bunch of different things. Um, and when it came time for me, I got into UF. When it came time for me to choose a major, it was just kind of like at that point we didn't have a bachelor's in public health program. We had the bachelor's of health science. So I think I went in going, okay, let's do business administration because I like everything. This maybe I'll go into hospitality, like this fits. But then really thinking about it, I don't even know how I stumbled upon public health, but it was basically, I think it was a master's in healthcare administration and that type of undergraduate degree. So that's kind of where, business administration, healthcare administration, bachelor's, public health, that's kind of where I stumbled upon. And learning more about public health, it was just kind of like, oh, I can be creative. Oh, I could coordinate, programs. Oh, it has to do with healthcare and medicine to some degree. Oh, like all those things. So that's kind of where it fit. And kind of what resonated with me specific to public health is just kind of my parents are immigrants. So I don't remember what age, but at some age, and I feel like a lot of, Latinas like myself can resonate with this. At some age, I had to fill out or help my mom fill out inpatient paperwork, some type of paperwork that, the language was very difficult. So although my mom speaks very good English and has a very good understanding, it's her second language, but you know, it's what I consider to be very good. That it was just hard for her to fill out. And I thought that because I was young, I could, that's why it was difficult for me to fill out and read, but I was able to. But even as an adult, I'm like, this stuff is hard. I'm a college educated individual. Like, I consider myself a pretty intelligent person. Like, why is this so difficult? So I think that is kind of what like sealed the deal for me. Just kind of, if I consider myself a very blessed individual with all the opportunities in the world. So if I'm having an issue, I can't imagine, you know, people that have a little bit less than me what they're going through. Um, So that's kind of where it started. I feel like that was a long answer, but it's from the heart and honest.
Yeah, and I appreciate that. And I definitely think there is a lot of work that needs to be done on the health literacy side, just because it is such a complex field, and the questions and the disconnect between, as I was saying earlier, between the doctors and the patients can be very alarming sometimes. So I definitely well understand where you're coming from, having to fill out those forms and not really understanding what to do there. So thank you for sharing
Yeah.
that. So what public health issue resonates with you?
I think it's a very general thing, but it's just how I feel, just social determinants of health, like it, it is what it is. That's just what resonates with me, all these things that have to do with how you are as a person. So your childhood, your economic status, your opportunities in education, all those things play a really big part in your health outcomes, and it seems to me so simple and, pretty black and white compared to everything else, but it's just something that I feel that isn't focused on enough. In public health, it is for sure, but in the grand scheme of things, in medicine where the dollars are going, that's not what is focused on. So, you know, as basic as it is, that's what resonates with me the most. Again, like I mentioned before, health literacy, you know, regardless of your education, those things are not easy to read. And we're not set up in a system where it makes it easy for you to ask for help, whether it's because you know maybe the nurse you want to ask for help, she's going through burnout herself because she's like that is also a public health factor. So um just all those things I feel like would make it a lot easier for doctors and individuals that are meeting with patients. Hopefully we come to a time where doctors aren't needed as much just because we're taking all the preventative measures and we're being proactive on how we're setting things up, that it doesn't get to the point where people are going to the doctor at the last minute because it's an acute problem at this point. So
Yeah, I agree with that. Socially determinants of health is something that resonates with me also. And it is weird just seeing that we do focus a lot more on the treatment side of things rather than prevention. And if the same amount of money was going into the social determinants of health that was going into healthcare, we definitely wouldn't need as much healthcare necessarily, just because we would have the programs and the other interventions to prevent them going to the
right.
costly healthcare system. So thank you for
I
sharing.
feel like we've done like a step towards preventative care. So for instance, eat healthy, like exercise. Yeah, that's very easy to say, but then if you don't have a sidewalk for you to a well-lit area for you to walk around with your family. I mean, now in quarantine, now more than ever, with everyone's gyms are shut down, like, do you have a safe space for you to go for a walk? Do you have a close grocery store for you to access good, healthy food? And how expensive is this food that the price of grapes is insane, like $10 for a bag, and you see it's two something, but then when you add up the pounds, and it's just, those are the things. So okay, yeah, we've gotten to eat better, be healthy, okay, but why aren't we able to do those things? It's not that we don't want to, or it's just that we're not able to sometimes. So that's how I feel.
Yeah, the systems are definitely not there trying to help people be more healthy and take more control of their lives. It's definitely working in the opposite way. That is how it is. So, why did you choose to do your Masters of Public Health after your Bachelors of Health Sciences?
um it was just a natural fit. Honestly, throughout my undergraduate degree, I had a mentor that was just so helpful. I was able to as an undergraduate get published under his paper, his creative way of addressing situations. Dr. Mark Hart, he basically was very interested in public health and an intersection in public health and technology. And he was working on very interesting research with Twitter amongst public health professionals. And I was able to work on that project, and kind of that's where like my creativity started going again. And just what can you do with what you have? Social media is free. Social networking is free. And in a situation like public health, where we're very dependent on funding, and sometimes we're not the first place where funding goes, you know, being able to be creative and use those resources for public health was just something that, you know, I blew my mind, and he was always there guiding me. So, and he was an instructor for many classes and was the director for the online MPH program. So, you know, he sold me. And then once I got into the program, you know, learning more and more, and interacting more with our instructors, just on a more mature level. I feel like in undergrad, classes are bigger and everyone's fun and things like that. But once you're in graduate school, it's a smaller, you know, the discussions that you're having are more focused and in depth. And that's when you really get to know your professors. And I had the privilege of, you know, as a public health track student in an undergrad, I already had got to know the professors a little bit. So I already knew I liked it. And then once I got into the MPH program and being able to solidify those relationships with my instructors just made it even better. I didn't really I felt like going to school was just, I wanted more. I was ready for more, and I was afraid that if I went out and worked for a little bit or anything like that, I wouldn't have the opportunity to come back and really have the drive as I did in that time. So I definitely wanted to take advantage of, you know, already being in Gainesville and having a really great network, and it just worked for me.
Okay. And why did you choose to do your concentration in social behavioral sciences?
Again, it's for me, it was those social determinants of health. And in social and behavioral sciences, you take a deep dive in understanding how society works and what you can do to meet, you know, your population where they are. And in my opinion, that's the best way. So that was just what was of interest to me. So looking at different populations, looking at different diseases and how they affect those different populations. So how everything is connected, but you also need to kind of break it apart and have a different approach for each different situation. So that's really, you know, what social and behavioral sciences is about. One of the classes that, you know, that specific concentration has is program planning and evaluation. So basically those classes allow you to approach a problem, you know, have a way to address it, and then see how you can evaluate, you know, the program that you put in place to address that issue. So kind of seeing an issue from start to finish, and really making sure, once again, that you take a double take and make sure that it's working. That is what I feel taught me a lot. Also, the grant writing class that we have, what's the research methods class, that part of the coursework is to write a grant. That was something that was super valuable, you know, specifically, you know, in Florida, that's something that I had to do week 2. And I, you know, was I 100% ready? Maybe not, but I knew where to start. I was like, okay, I can do this. You know what I mean? It's terrifying knowing that, you know, words on a paper is what's gonna, you know, help this population or not. So I think all of those classes are essential and really helped me. And I always encourage, people outside of that concentration, to take that if if they can.
Yeah, and I resonate with that too. Unfortunately, I did not get to take any grant writing classes, and I did have to like apply for a grant last year, and that was definitely a learning process for me. But it's definitely necessary. So I definitely say take those classes because grants are important in public health because you're going to need funding somehow in some way.
Yeah,
So I know you spoke
agreed.
about working at Well Florida. Tell us about how you got that job. Was that through UF or did you have the job before you graduated and whatnot?
So I guess once again, it speaks to the MPH program and your mentor, um, Dr. Mark Hart. When so we have different partnerships or relationships with different organizations in Gainesville, with Well Florida being one of them. And the CEO said that there was a position available, and if anybody, knew of any students that would, be good candidates. And my mentor mentioned my name, and I was one of a handful of students that were brought to uh, the the CEO's attention. So that was, amazing. And then I graduated on a Friday and I started working for Well Florida on Monday. So, yeah, I mean, I could have applied on my own, but had it not been for that relationship between that organization and UF and the relationships between my mentor and you know, I don't know if I would have gotten the position or not. So that was amazing. Um, yeah, I think I answered that. Yeah.
Yeah, and I definitely agree with that. I worked at Well Florida, and how I got that was through the CEO of Well Florida. Also, he was my professor in two classes, and he's like, "If any of you want to come intern, just let me know." And through that, I was able to do my internship, and I learned a lot, and it's helped me a lot during my public health career so far. So I definitely love that the MPH program had those. Well, I love that they had a professor who was a CEO of a nonprofit around and he got to teach his classes, which was very informative. And it was a lot different than having like a regular professor who does academia only.
Mhm.
So you were a HIV prevention planner. What was that? What does that role do? What was it like?
Yeah, so a little bit about Well Florida in general is that they basically house or manage um, projects. So, one of them being the Ryan White program for individuals affected by HIV/AIDS, Healthy Start, which is for maternal and child care and child health, things of that nature. So, what project I was working on was a project that is funneled through the health department. So their funds that well, Florida was hired to manage the project. So it's basically HIV/AIDS prevention. So that ranged from putting together HIV testing sites, putting together advocacy events, putting together any safer sex education programs for schools or fraternities, sororities, anything of that nature. And it was also treatment and adherence. Um, so something I would do is I would meet with HIV positive individuals in rural communities surrounding Gainesville and make sure that they need that whatever it is that they needed, they had. So beyond their medication. So how are they doing mentally? How is their housing? You know, some of these individuals are getting mailed their prescriptions, their medication. If you don't have an address, why would taking your medication be a priority for you? So, speaking with these individuals face to face and making sure that they have everything they need was a big part of it. But it was from start to finish was that program, from treatment to getting tested and engaging with the community was the what made up that program. And like I mentioned before, grant writing was part of that role. So um, that that program lasts for, I believe, 4 to 5 years, if I'm not mistaken. So every 4 to 5 years, you have to reapply for that funding. And my final, months there, that was what we were working on. So luckily, everything worked out perfectly, and we were able to get even more funding based on our ideas and how successful we were before. So it was just amazing to leave off on that foot, for sure. So I think that position, it was just so variable, and it covered so many different things, meeting with local health departments, administrators, things like that. All of that was just amazing. And I wasn't behind a desk, which I was really scared of, coming straight out of, graduate school. I'm like, I've been like a free bird this whole time doing all these things. Like, what am I going to do behind a desk all this time? And that wasn't the case. I was in the communities, not only in Gainesville, the surrounding 16 counties, meeting different people, meeting people younger than me, meeting people my same age, and meeting individuals older than me that have been in public health for a number of years. So it was just a really amazing opportunity. And I'm so happy that that was my first job coming out of school, because, it really made me practice all of the things that I learned in school within a short amount of time. So, I didn't get rusty.
Yeah, sounds like you really got a holistic experience and got to touch on a lot of different things, which is really great, and help a lot of people that need help, and where there's a lot of stigma still, unfortunately.
Right.
So you spoke about, well, let's just, so from your HIV prevention role, while I was interning at Florida, you transitioned out and you moved into your health science and public health program recruiter role at UF. So
Mhm.
why did you decide to switch it up like that?
I mean, to be honest, so it was, I was gonna go back to the place where it brought me so much happiness. So I'm basically working for, the MPH program, which is where I spent, between undergrad and grad, 6 years. And I had the opportunity to work alongside my mentor. So, I just felt like it was something I wanted to look into, something I wanted to take the opportunity, and working with individuals that are doing, really great things in public health on an academia level. So I got the community experience through Florida, but I wanted to see what it's like on the academia level. And that's where I am today. I mean, I'm able to speak to students that are a bit confused and where I was maybe a few years ago, and kind of help them through it. At the same time, I'm working alongside, really amazing people that are, revolutionizing public health in Gainesville. And with that being said, the relationship between, the UF MPH program and Florida is so tight knit. I've seen, Lindsay and Jeff and Caitlin, in our events and around campus and in our college. So that tie was never really broken. So being able to get the best of both worlds was, just what I needed at the time, for sure.
Okay, cool. And I definitely think it speaks to how small the public health field could be in a certain area, just because a lot of the people are definitely talking, and there's a lot of collaboration in a lot of different aspects.
Right. Number one, collaboration, because there's there's no way you can approach a situation with just one view or state of mind. There definitely needs to be, you know, different aspects in order to properly address the situation.
Yeah, it's so important to have different perspectives to really have a robust solution to these issues that are very complex. So you said that you do some talking with students. What else do you do in your role?
So currently, right now, I'm working alongside the internship position, so helping students um, get an internship site for their final semester in the program. So still collaborating with other agencies such as, well, Florida, such as Swanee River, AHEC, and looking for new opportunities for those students. So working alongside community leaders. I'm also working with the PhD program. So students that are deciding to pursue a PhD in social and behavioral sciences, working alongside them. Dr. Wood, Elizabeth Wood, she currently is working on research in migrant farm workers, and she has asked me to help with any translations in surveys or anything like that. So I'm just like doing a whole bunch of little things wherever somebody needs me or needs my help. Like it varies every day. So, you know, just different things.
And that's great. And I'm betting that keeps the job exciting and keeps you wanting to come back because it's not always the same thing over and over.
Right.
So what would you say that you like most and you like least about your job?
I like most just working with different people. So working with students, working with, community leaders, working with, the deans of the college, working with professors, working with outside agencies that are public health related, working with other colleges within health science, so pharmacy, nursing, things like that. I think, like you said, it keeps it super exciting, and I feel like I've become more well-rounded. What I don't like is just in any job, I guess, is the political aspect to it. Um, so there's like politics in academia, in Florida, based on whatever was going on in the government, that was what that basically structured what we were going to do, and what funding we were going to apply for. For instance, if there was a grant specific to heart disease, but we saw a need for, dental health and dental hygiene, we can't do anything about dental hygiene, but let's do what we can in heart disease because that's where the money is. So that kind of politics is just ah, but it's something that you just have to navigate as best you can, and address it.
Yeah, yeah.
Try to change it.
Yeah, and that's always going to be a part of the rule. I feel like just because there's so many different pulling places pulling for different funding,
Yes.
and so it's not easy. And definitely trying to advocate for your issues is something that's needed, but it's not easy to do.
Yeah. In academia, for instance, like maybe somebody is more qualified, but they don't have a PhD. So then the person that has a PhD but hasn't really been in the community, addressing these public health issues. So that's what gets kind of confusing and frustrating. But I mean, it's all you're able to work through it, and it's fine.
Okay, okay, thank you. So where do you want to see yourself in the future?
Honestly, right now, I don't know when, but I feel like I would like to pursue nursing. Um, when I started with the Bachelor of Health Science, I took all my prereqs for nursing as well. It's something that I played with for a while, but then public health and my mentor and the MPH was just what I really wanted. But now more so, I kind of want to combine the prevention with the treatment, and being a public health nurse, and mobile outreach clinics and things like that. Those are things that I've been more and more interested. I definitely want to take my time to do that because I feel like I'm learning a lot and learning how programs and some systems work,
Mhm.
via academia. So I definitely want to enjoy my time in it and take advantage of all the different roles I'm playing right now. But I feel like in some time that's something that's gonna start, you know, creeping into my my life.
Okay, interesting. I look forward to seeing that journey, and maybe we'll talk a little bit later on, talking about your nursing and public health journey. That'd be
Yes.
awesome. Okay, so I'm going to move you on to the last section of the show. It is called the Furious Five. It's 5 questions that I'm going to ask all guests. So, question number one: what advice would you give a student trying to pursue a career in public health?
I would just say that if you can find somebody that is doing work that you are interested in, hold on to them for dear life and try to suck all the information out of them that you can. It's just, it's always good to have a mentor, whether it's a professor or somebody a little older than you know, a second year student versus a first year. Just and don't be afraid to ask questions. So that comes with that. So find somebody that you're comfortable with, that you like the work that they're doing, and ask them as many questions as possible. That'll help you to kind of differentiate what you like, what you don't like, and where you want to go. Um, and and if you can find 2 people, 3 people, do it with as many people as you can, because that'll definitely make you a wiser person for sure.
Okay, yeah, and I definitely think being curious, especially as public health isn't really understood, and there's a lot of different things that go into public health, being curious to understand what people are doing can be extremely helpful.
Yes, exactly.
So, number two, if you were talking to someone wanting to get into your position, what advice would you give them?
So speaking on the position that I had in Florida, um, I feel like also depending on where you live, having a second language is amazing if you can do it, or be conversational in it. In Florida, that's just necessary at this point. Um, Also, just if being very invested in your classes. Every single class that I took, I had to put into action once I was in the position. So, you know, in that interview, I was able to speak on different projects or different things that I had done that, you know, resonated or what was a small part of what I was going to be doing in that position. So take your classes seriously. Um, and what else? Network. I mean, really under, understanding that those mentors, those relationships, that could be the difference between you getting the position and not. Um, so whether it's, you know, my position at Florida or the position that I got um, here for the MPH program, um, being versed in public health is important. Having those mentors and connections is important. And, you know, whether you're in courses or there's a seminar you can go to or something online that you can attend that will just keep you up to date on what's going on in public health is important.
Yeah, some invaluable advice there, everyone. Number three, what's something you're working on improving in your life right now?
Reading. I feel like I've gotten out of touch with reading, and it was something I have enjoyed. Um, and now, you know, with audiobooks and podcasts and things like that, I just informing yourself, but also just picking up a book and looking at words and, you know, looking up words if you don't know what words are, you know, what that word means. Um, that's something that I'm trying to work on. More and more, and things, there's definitely books that have been recommended to me that, you know, have a lot to do with what's been going on the past uh, weeks, months. So, and I have kind of like a fire for it right now, and I don't want that to go out. So being up to date and reading is just something that I think would be just, I need to take advantage of it right now.
Okay. Well, I hope you're able to start reading soon.
I
So
did.
now,
I started like a week ago, so.
okay, awesome. Let's keep it up then. Awesome. So number four, professionally, do you recommend anything?
So I think yes. So anything Malcolm Gladwell, I love. That's something that my mentor basically kind of put me on. One of his podcasts that I really like is Revisionist History, where it's basically that he goes and kind of uncovers topics, revisits topics that have been forgotten. So it just, and the topics vary. One topic was Toyota Camrys, another one was like a rally and what happened in that rally. So he just kind of goes back and investigates those and finds out what really happened and why that situation happened. I say that professionally in the sense that it gives you a little bit of everything. So, depending on if you're on an interview or if you meet somebody new and you need to strike up, sorry, a conversation, or if somebody's talking about something, you're going to have something to contribute. Just because there's something that Malcolm Gladwell said that you're going to be able to just insert into that conversation and it grows into something else. So personally for yourself and professionally, so you can just converse with people and get to know people and connect with them on a different level.
Okay, and I'll definitely have to check that out.
Yeah.
Revisionist history. It sounds very cool and interesting, and gives like
His voice is so like, I don't know, I wouldn't say soothing, but if I wrote a book, I would want him to record it for me, because it's just a very engaging voice that he has, and he's the one that does his own audiobooks and his podcast. So
Okay, awesome. So I'll definitely put that on my list to check it out, and I will leave that in the show notes for anyone. So last question, where can people connect with you?
yeah, so you can email me directly at kattypiz@phhp.ufl.edu, or we have our UF MPH Facebook, and I'm the one that posts and is typically the contact person for the Facebook, and that is UF MPH on Facebook.
Okay, great. Thank you. And I'll definitely leave all of this information in the show notes. So this is the conclusion of our show today. I am very happy that I got to talk to Katherine both about the public health bachelor's program, the master's program, and about her journey in public health. I look forward to seeing what she has in store for us going forward with her nursing in public health. And I just really enjoyed this conversation. So definitely feel free to reach out to Katherine if you have any questions about UF's Bachelor's or MPH program, and she would be more than happy to help you. So thank you so much, Katherine, for being on today. I will
My
talk to you sometime soon.
pleasure.
Yeah.
Yes.
Take care.
Bye.
Bye-bye. As always, thank you all for sticking around for this long. I really appreciate it. I'm glad that I got to sit down with Katherine and really talk about University of Florida's public health program, both bachelor's and master's program, as well as a combined degree program. I know there's a lot of value that is there for anyone that might be looking to go into a career in public health. So definitely reach out to Katherine. I will have all this information in the show notes, which will be at thephmillennial.com/episode 7. So definitely check that out. If you have not as yet, definitely subscribe, give the show a like, review it, and I really appreciate you taking your time to listen or look at this show, and definitely share with a friend if you have found value in this. Thank you so much for listening. The Public Health Millennial out.